is up, everyone? Today I'm going to be going on an 18-hour flight from Los Angeles to Singapore, and I'm going to be sharing with you all of my airplane health tips to help you feeling safe and healthy from a doctor's perspective. We are going to be talking about everything from motion sickness to back pain to jet lag and something that can kill you if you're not paying attention. Wait, what? No, I'm serious, so keep on watching. What is up, everyone? It's Everyday Jan. My channel is all about health and wealth and how to make everyday yours. If you're new here, then hit that subscribe button for more videos. No cliffhangers here. Let's talk about what I was just talking about. And if you don't watch out for it, you can actually die. What I'm referring to is a blood clot developing in your legs and then traveling to your lungs. When we're sitting for a long time, the blood flow in our legs gets stagnant, and that's how a clot can develop. And when the clot develops in the leg, it's called a DVT, and that clot can then travel up to your lungs, and that's called a pulmonary embolism. When the clot travels from your legs to your lungs, it can then cause tissue damage to your lungs, and we all need our lungs in order to breathe and survive, and that's why people die from this. It's rare, but it can happen. The biggest risk factor is if the flight is more than 4 hours, and that can apply not just to flying, but also traveling by plane or by car. There are increased risk factors if you have any prolonged immobility, if you're elderly, obese, or had any recent surgery. The symptoms of a blood clot in a leg include having swelling and pain in the leg, having it be warm to touch, and redness. If that happens, seek medical attention immediately to get some further workup, such as an ultrasound, to see if there's actually a clot there. The best way to prevent a DVT is to increase blood flow. So walk around, go to the bathroom every few hours to increase that blood flow in your legs. Also, while you're sitting, you can do different exercises like a calf stretch, where you extend your leg and pull your ankle towards you, and hold that for 30 seconds and repeat it. You can also do ankle pumps as well as ankle circles. Also, if you're really concerned about it and at increased risk, you can consider wearing compression stockings, and these are used to exert pressure onto the calf and prevent the blood from pooling in your legs. So I am a PM&R doctor, and I'm betting that you probably have no idea what that is. It's a specialty where we focus on restoring function and quality of life in people with physical impairments. And that means I also treat things like back pain, neck pain, knee pain, shoulder pain, all that kind of stuff. So I'm going to be teaching you some exercises that you can do on the plane to help prevent any of those back pain and aches that you always get. The piriformis stretch, where you cross one leg over like a figure 4, bend at the hip, and keep your back straight. Hopefully you don't have stinky feet and your neighbor doesn't mind. Pelvic tilts, draw your belly button in and tilt the pelvis forwards, then flex through the back and tilt the pelvis forward. This isn't actually a stretch, but it's an exercise that can help relieve back pain. Spinal twist, keep your back straight and rotate to one side at a time. Posterior capsule stretch, bring your arm across your body and feel a stretch in your shoulder. Scapular squeezes, again, this is an exercise. While having good posture, bring your elbows towards your back and feel your shoulder blades squeeze. Upper trap stretch, where you bend your ear towards your elbow. Next is stretching the levators, where you rotate and bend your neck forwards so you're smelling your armpit. Apply pressure over your head and feel the opposite side stretch. Scaly stretch, where you are rotating your neck and looking upwards. Neck rotation, where you tuck your chin slightly down and rotate your head left and right. Now the next few stretches are standing stretches. So if you are able to stand in the alleyway, then maybe you can do these. Otherwise, you can just do these in the airport when you're just waiting to board. Hip flexor stretch, keep your back straight and your hip bones pointing forwards. Hamstring stretch, find a seat or a ledge, straighten your leg and keep your back straight and feel those hamstrings stretch. Doorway quadratus lumborum stretch, cross one leg over the other and bend towards the side. Doorway stretch is for your tight chest muscles. Keep your arm at 90 degrees and move your body forwards and you should feel a stretch in your chest. Airplanes have low air pressure and extremely low humidity. I mean, it is as dry as the Sahara Desert out there. Therefore, it's very easy to get dehydrated on the plane. Water is super expensive at the airport, so I usually just bring an empty water bottle from home. And since we can't bring liquids through security, I just fill up the water after security. I love using a UV sanitizing water bottle like Clot. That way I can refill my bottle at any water fountain, and the Clot bottle has an extra UV sanitation, so it helps kill the germs. Limit your intake of alcohol and caffeine, as both of those can dehydrate you even faster. Airplanes have really low humidity. The cabin humidity is usually around 10 to 20% versus normal indoor humidity is around 30 to 65%. With the low humidity of the airplane, my eyes, my lips, and my skin dry out super easily. So I always pack some eye drops, some lip balm, and also a moisturizer. Also, it's not a good idea to wear contacts, especially if your flight is long. So switch those contacts out for glasses, because otherwise those contacts can become very dry and it's not good for your eyes. It's tough to feel rested on the plane, but here are some of the things that you can do to help get better rest. First is melatonin. Melatonin is a hormone in our body that is naturally produced to promote sleep. When I'm traveling and get jet lag, I usually like to take 3 to 6 milligrams of melatonin to help encourage my body to sleep. I also bring some earplugs or noise canceling headphones, and that just helps reduce the loud airplane noises. I also bring an eye mask, which limits the light and helps me rest better. Also, wearing socks. There was one study that showed that young men wearing socks fell asleep 7.5 minutes faster, slept 32 minutes longer, and woke up 7.5 times less than those not wearing socks. So maybe consider wearing socks the next time you can't fall asleep. Also, a neck pillow and a back pillow can just help you rest better, and wearing some comfy clothing. Best case is if you really want to get the best rest, then see if you can upgrade your seat to business class with points. Heard this so many times from other people about people getting sick on the planes, and this is even pre-COVID era. Air in the cabin passes through HEPA filters, and 50% is recycled air and 50% is fresh air. A sneeze can actually travel up to 25 feet, which is kind of gross. Hand sanitizer is a must for me, especially when going to the bathroom on the airplane. To wash your hands can be inconvenient. I also bring disposable wipes. Now, airlines supposedly do a deep clean every 4 to 6 weeks, and in between flights they supposedly spray disinfectant. But if you are a clean freak or get sick easily, or you're immunocompromised, just a quick wipe down can give you a better peace of mind and limit the chance of getting sick. Motion sickness is also very common. Everybody experiences motion sickness at least once in their lifetime. I've definitely had motion sickness, and it sucks. And it can happen anytime you're moving in a plane, in a car, in a boat, and even virtual reality. The treatment is to modify the environment, but obviously if you're in a plane, that's not going to be possible to do. So the next line of treatment is medications. First, there's over-the-counter medications like Dramamine that you can buy without having a doctor's prescription. And it works by blocking a histamine receptor in the vomiting center in the brain. It has some side effects such as drowsiness, which is the most common, dry mouth, blurry vision, and constipation. Take Dramamine 30 minutes to 1 hour before you actually travel. Now, Dramamine is a brand where they make different medications, and they make a less drowsy version that's called meclizine, but it still has potential drowsy side effects. Another medication for motion sickness is scopolamine, which is a transdermal patch, so you put it behind your ear. Scopolamine is a prescription medication, so you do need a prescription from your doctor. Now, if you're not a big pill person, there are other alternative things that you can use for your motion sickness that I use myself. First is ginger. Personally, I love ginger. It works really well for me, and I take ginger drops whenever I travel. Now, there have been some studies done on ginger, and some of the studies show that it helps, while others show that it doesn't. And it's also mostly been studied in pregnancy and chemotherapy. Regardless, more studies need to be done on it. Another alternative is peppermint. Peppermint comes in different forms, such as an essential oil, peppermint drops, and also tablet. I'm not a GI doctor, but one of my best friends is, and she recommends it. There have been studies done on peppermint in the use of chemo-induced nausea and vomiting, and it has been shown to help. Another thing that can potentially help with motion sickness is acupressure. The pressure is applied to the P6 point, which is located on the anterior surface of the forearm and between the two tendons of the inside of the forearm. Also, if you have motion sickness, then avoid eating a heavy meal before you fly. Sorry to say this, but save that In-N-Out burger for next time. Don't eat anything that's greasy, spicy, or acidic. My poor husband really learned this one the hard way. Stick to simple carbs like bread, crackers, cereal, and bananas. Alright, I hope that video was helpful for you guys. Let me know in the comments below where you're traveling next. I'd love to hear from you. Don't forget to like and subscribe for more videos. This video is for educational purposes. This is not medical advice. If you have medical conditions, then please consult with your own doctor. Bye for now.